technique I want to share with you. If you're having any kind of shoulder pain, particularly difficulty raising your shoulder up, maybe from bursitis, adhesive capsulitis, frozen shoulder, or just notice that your shoulder is just having difficulty getting up, being able to grab something or reach over our head. Well, here is a technique that's really going to do wonders fast. So let's look at the anatomy of the deltoid muscles. You have the anterior in the front, the middle or medial in the middle, and the posterior in the rear. And they make its way down the arm into one area called the deltoid tuberosity. You can feel like a ridge or a bump as you make your way down there. Now, the easiest way to locate the deltoid tuberosity is to take your thumb and second finger, spread it out, put your thumb on top of the acromion process. It's like a hard bone you'll feel right on top of the shoulder, and just kind of stretch your other finger down. You'll be right on it. And that's the area that we're going to release. Now, most shoulder pain and restriction, adhesive capsulitis or bursitis or frozen shoulder, is referred back into this area. The problem is that no one is releasing it. When we release it, you're going to see immediate change, and you're going to be real happy. So that takes me to my magic tool, the old knife. Now, not a sharp knife, a butter knife, or a dull knife, but we're going to use the thick end. I love the surface of this because it's thick. It's not too sharp. It's nice and smooth. So let's get right to it. Let's pull the sleeve up. If I lift my arm up, you can see the deltoid muscle right here on the lateral side attached.
Garana.com लाया है आपके लिए इस्लामाबाद की बेस्ट लोकेशंस पर इमारत ग्रुप ऑफ
Attaches right in the side of the arm, and if you put your finger on it, it's going to be a little tender. Now, what I like to do is preferably let the arm fall to the side so you don't contract the muscle. So as we just strip it for about 30 seconds, and you'll feel a big lump, a big bump on there as you're stripping it, but as you strip it, guess what? That bump goes down, and it starts to become smooth. And you'll notice right after, within about 30 seconds, you'll be able to have so much more ranges of motion. So here are some very important tips. 1, use oil or lotion on the skin. 2, when you use this tool, it can be very abrasive. Do not push to the region as well as oxygen and nutrition. Over the course of days, your range of motion should continue to improve. I hope this video was helpful for you, and if it was, please share it on your social media.